Hello everyone, and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting pain management specialist Dr. Alexis. Today, we will be discussing pain medication and sleep. Welcome to the show, Dr. Alexis.
Thank you.
So what are some of the medications that you use to manage chronic pain in patients?
So I use a host of medications. Typically starts with an anti-inflammatory medication. That is your typical Motrin, Advil to reduce inflammation. That typically helps with joint pains. And second, we can use a muscle relaxant and benzodiazepine to relax spasms. We can utilize anticonvulsants or neuropathic agents that can reduce nerve pain elements, sciatica, pinched nerves, whatever those might be. Then obviously we also have opioids, which are a little bit more direct to just block or blunt pain. They work on the opioid receptor. It's a natural receptor in us, and they allow us to modulate pain and be able to better tolerate pain. It doesn't treat pain, but it helps us not care so much about the pain. And while it may not be the best agent to use long-term wise, that's for sure, it's much better used as an acute medication.
So what are some of the side effects of opioids?
Sure. So some side effects of opioids are going to be constipation. There's going to be the fact that it can slow your respiratory rate. I don't know if people really understand that, but that's how people die from an overdose. It's not so much their heart stops working, it's that they just stop breathing. So opioids, unfortunately, decrease your strength that you're able to breathe with, and also the frequency of how often you're able to breathe. Plus, it also affects your mentation, your immune system, and a host of other issues, chronically especially.
What other bodily systems are affected by opioids?
Like I think as we said, the digestive tract can be affected, your immune system can be affected, your testosterone, your estrogen, your hormones can be completely affected. Your sleep can be thrown off, and this is the problem. The problem is patients misuse the opioids because it does allow them to sleep. Initially, it allows them to sleep until it no longer works anymore, and then doesn't allow them to sleep that well. So patients typically will use this medication so they can get a better night's sleep.
Can you tell us a little bit about how opioids affect sleep?
So the side effects of opioids is, one, it's going to cause respiratory depression. So that means you're going to breathe less. You're going to breathe less frequently. So, and that's why patients overdose. It's not that they have a heart attack. They just stop breathing. Not only that, it affects your sleep. You're just not going to sleep well. The problem with the opioids is it doesn't really allow you to get the REM sleep that you're looking for. So you wake up saying, hey, I slept 10 hours. Why do I feel like a zombie? And you hear that over and over again. Which should alert me as a physician, hey, maybe there's more issues than just pain causing this patient not able to sleep. Maybe there's other medical issues. Maybe they need a sleep study. A diagnosis of obstructive sleep apnea.
So it sounds like quality sleep is obviously important for these patients who are undergoing chronic pain management. What do you recommend for them?
Well, it's a good question. So the main thing is information. Information is power, and the patient needs to have an appropriate diagnosis of certain things. We need to know what's going on. We need to know why the patient is not sleeping well. And what I want to just conclude for whoever's watching is not to assume anything and to ask questions. And if it's easy, don't just take the easy route. So a lot of my patients may consume an opioid because, yes, it takes away their pain, and maybe initially it helps induce their sleep. I don't want any of my patients to become dependent on opioids. The goal is to live a happy, healthy life, and therefore we need to really see what the actual problem is. If it's a pain issue, come to pain management, we'll take care of it. If it's a sleep issue, we need to have you see a sleep doctor so you can probably get diagnosed and treated. And there's lots of different treatments out there these days. Mm-hmm. Some include a CPAP, some just a simple oral appliance. There's many options that we just need to be, all of us, aware of and explore our options.
All right, well, great. Thank you for coming on.
Thank you.
And that completes this episode of And Sleep, a whole you social talk show series with Dr. Alexis. We encourage you to explore the rest of the episodes and visit wholeyou.com to learn more about sleep breathing disorder treatments. The sleep professionals in this video series teamed up with Whole U to spread healthy sleep education across America and were paid for their appearances.